My name is Carol Scott, and I'm the Director of Women and Infants here at Barnes-Jewish Hospital. Cord blood donation is the donation of actually cord blood from the placenta and the cord from the mom to the baby at the time of birth. The donations have helped many people, not only in our community, but the country and actually worldwide. The service itself is free and easy to do. It is very easy. The cord blood bank actually provides us the kit, and it's a box that has a questionnaire for the patient, the consent, and an easy collection. We collect it just the same time that we're drawing the blood that we do on every patient. We collect some of the cord blood, we put it in the bag, we put it in a box, and the bank, the cord blood bank, actually comes 7 days a week and picks that up for us. Cord blood is essentially the same as our cells in our bone marrow. So what has been found is that this can be used and is used to treat many cancers, immune disease, sickle cell disease. Now again, it is matched with the potential patient and then is used to transfuse that patient and to treat and hopefully cure their disease. On a quarterly basis, what we get back from the St. Louis Cord Blood Bank is how many units were actually banked, which means that they can then be usable and that they use them for transplant. So for instance, last quarter we received a report that 41 units were actually banked and used around the world. Some of the types of diseases where we treated 9 patients with acute lymphocytic leukemia. We treated acute myelogenous leukemia in 13 different patients, and then we did some very rare sort of things with neuroblastomas, non-Hodgkin's lymphoma, etc. We actually have had a letter which was in the last year, but a patient had actually gone back through the St. Louis Cord Blood Bank and found that the source was actually our hospital, and sent us a letter thanking us for saving his life, and he actually lived in Ethiopia. In 2009, the nurses decided that once they were getting results back and seeing, what good was actually coming out of what we did, they decided to make it a unit goal that we should be giving more and that we should increase our donations. So as a project last year, they took it upon themselves to have a contest and to beat the prior years as far as how many donations that we gave.
I'm Rebecca Kisa-King. I am an RN at Barnes-Jewish Hospital in Labor and Delivery. We did have a contest. Okay. I got 3rd place. I was a new nurse at the time, and heard about the contest, so it did give us all a little extra push to encourage our patients to donate their cord blood. I was a cord blood donor myself when I had my daughter. I have a almost 3-year-old. I think that it's so important if God forbid anything happened to her or anyone I knew, the option to have, it's close to bone marrow, in its uses, and the stem cells are used for so many different things that I think it's great to have that option available, and when it's free and there's no risks, I think it's just an amazing thing that our moms have the opportunity to do so.
So actually in 2008, we collected 348 units and banked 76 of those. Last year we had a 99.7% increase, and we actually collected 695 and banked 168 units. So the nurses were very proud of themselves. I hope that everyone understands just how good this program is, what good comes out of it. I would say probably if there was one area we could improve on is the diverse population that we do serve. It is known to help or cure or treat sickle cell, and if we could have more donations from our diverse populations, I think that we would see even more good come out of this program.